Beloit Health System is committed to our community and dedicated to your health. This commitment to our community is never more evident through the expert and compassionate care that we provide in our emergency department. When seconds count, we're here for you.
And she was short of breath and she was having chest pain.
We're here 24/7, 365, no matter the weather, no matter the conditions. We're here to treat whatever you need.
I've been told that my heart stopped 4 times.
We are a level 3 trauma center, a 24/7 cath lab, meaning that if someone comes in having a heart attack, they go straight up to the cath lab.
My mom's heart did not just stop 4 times. You know, I was hearing it, but it didn't. I'm gonna end up crying.
I'm sorry.
We provide a healthcare service in the community that allows our patients to stay in the community.
The nurses were all very kind.
The determination of the doctors to keep me alive was just amazing.
This starts with our commitment to provide medical training and education and medical control to ensure that when EMS personnel show up on the scene, they have been trained in the latest life-saving techniques.
We are EMS medical control for many of the EMS agencies in Rock County.
And due to our partnership with the University of Wisconsin Hospital and Clinics, we have a direct tie to the state's #1 trauma center. And most recently, opening an urgent care option in our emergency room that will allow you and your family to have greater access to care on a non-emergency basis at a lower price point and value. Our commitment to the community is also evident through our passionate focus on patient quality, safety, and satisfaction. That's why we're making a large investment into conversion of our inpatient rooms to all private suites. We're also dedicated to your health through our passion to ensure that you and your family receive good access to care. This is evident through the implementation of our new orthopedic injury program, and most recently, the implementation of an orthopedic spine surgery program right here in Beloit.
Dr. Zadeplik is our most recent addition. He's got a great reputation, the same with Dr. Roche. So it's not just care locally, it's quality care locally. This allows a patient to get evaluated, treated, and receive their rehab all in the Beloit community without having to leave.
Beloit Health System is dedicated to your health. This dedication is never more evident in our passion to provide our physicians and caregivers the state-of-the-art technology to help treat you and your families. This includes the implementation of the latest robotic-assisted surgery device, the Da Vinci system.
So the Da Vinci machine takes laparoscopic surgery to the next level. It allows us to visualize much better than we have in the past with laparoscopic equipment. It also allows us to do surgeries that we may not have been able to do previously. So using a Da Vinci versus traditional laparoscopic surgery or even open surgery reduces the amount of time that a patient has to stay in the hospital. Having the Da Vinci here in Beloit will allow us to recruit the brightest, the most talented, and kind of bring those skills here and allow us to offer that to our patients.
We also are very excited to bring to the community in the State Line area the first implementation of the ION robotic-assisted technology.
We show our commitment to the community by innovative creations like this. And as we know, lung cancer is on an all-time rise here in our community.
So the thing about lung cancer is the earlier you make a diagnosis, the better the outcome for the patient. What ION does is we have smaller, much smaller, suspicious nodules, which will tell us very early on if you have cancer or not. And if we catch it early, patients are going to do better.
Commitment to the community is also evidenced by our constant improvement in our services and implementation of new programs, one of which is our new freestanding birth center, which is located on our North Point campus.
We've had 3 natural births at the hospital, and we're kind of looking into at-home birth. And then when Arlene brought up the birthing center, we knew that this was going to be a perfect match for us. In the morning, about 10 o'clock, like my very first contraction, I texted Josh right away. I'm like, I think I felt something, like we'll just keep an eye on it, nothing major right now. And then I started timing all of the contractions and I was like, oh, maybe, And then I knew that you were working an hour away. I gotta make sure that you are gonna be close if something happens. And then I was in communication with my mom. You don't have to rush over. and then called her 10 minutes later. I'm like, nope, we really gotta go in. So then I called Josh. I'm like, nope, it's time to go. So yeah, it happened very quickly.
We are also extremely excited about the renovation of the Beloit Clinic on the 4th floor and the creation of the Gold Family Care Center. This is an honor to Dr. Gold for his legacy of excellence in primary care.
Primary care is important to keep people from needing secondary care.
Well, Dr. Gold certainly set an example for a primary health care provider, and I think he's a good model for others to follow. A tough act to follow, but a good one.
We've been talking a lot about what I did in the old days, but to continue to bring in primary care doctors, you have to offer a facility that they would be proud to work in, and a healthcare facility that would bring in the best available technology.
We are proud of our commitment to the community and dedication to your health. We are thankful and appreciative of the faith that you put in us to provide you and your family the best care.